That's Dorma from the opera Turandot. I will conquer, I will conquer. Welcome to Healthy Vision, the talk radio show that helps you conquer your vision loss. Dr. Edward Conrad is a board-certified ophthalmologist and homeopathic doctor, author of 7 best-selling books. Healthy Vision is dedicated to bring you the latest information for a lifetime of healthy sight and to help you conquer your eye problems. And now your host, Dr. Edward Conrad.
Hello, everyone, and thank you for joining me on the new Healthy Vision. And I love that introductory music. I heard that for 22 years when I was doing Healthy Vision on KFNX radio. That's from the opera Turandot. And the Vintro is I will conquer. And that's the purpose of the new Healthy Vision, to help you conquer your vision problems. And today, I'm very excited. My guest is Dr. Mitch Fleisher. He's a good friend of mine. We both studied homeopathy together at the Hahnemann Homeopathic College in California. And he's been kind enough to join us to talk about restoring eye health, not only with homeopathy, with nutraceuticals, peptides, and exosomes. So, Dr. Fleisher, thank you so much.
Good morning, Ed. How are you doing?
Pretty good, pretty good. Your volume's a little low.
Okay. Is that better?
Maybe it's me. Maybe I have a hearing problem. But anyway,
is that any better, Ed?
Yeah, a little bit better. A little bit better.
Okay.
Folks, we're gonna have a little talk in the beginning, and then Dr. Fleischer is going to open it up for questions, and you can communicate with him either by raising your hand. There's a little icon down below. Raise your hand, or type something in the Q&A, or use the chat. So, Mitch, we both have a passion for homeopathy, and I think that's kind of like our approach in treating chronic disease, the homeopathic approach. So I wonder if we could begin just by sharing with us how you got interested in homeopathy, and a little bit about your homeopathic experience.
Well, thanks, Ed. I got interested in homeopathy actually in the first semester of medical school at Stanford, and I had already been interested in holistic medicine since I was about 17 years old, because I read my girlfriend gave me John Lust's Herbal Medicine, first book on naturopathy, and I got turned on to it back then. And I thought I was going to go into, after studying nutrition and herbal medicine, I thought I was going to go into traditional Chinese medicine and Ayurveda. But after my first experience with acupuncture, getting needles in the top of my feet, I said, how can I do this to kids? It hurts too much. And when I was at Stanford, I met a bunch of other students who were also inclined towards holistic medicine. And you know, Palo Alto, Menlo Park was like a hotbed of holistic medicine back then in the 70s. And we recruited some people to come speak. I actually put together an after-hours course in Introduction to Holistic Medicine. And one of the speakers we brought was Dr. Bill Gray. And Bill Gray was the father of, Bill was the father of the Renaissance of American homeopathic medicine after studying with Lotolkis. And he and I were close friends. Actually, I arranged to do a preceptorship through the Department of Family Community Preventive Medicine at Stanford with him for 3 solid months during the summer between my first and second year of medical school. And after doing that, I was sold. After seeing him treating a woman with Huntington's chorea and stabilizing her, treating a woman with steroid-dependent asthma and getting her off the steroids, I was blown away. and decided, okay, this is what I wanted to dedicate my life to. And I spent the next few years going up every weekend and seeing patients with him. And also that's when the Herring homeopathic group got together with Nancy Herrick and Roger Morrison and all those folks. And I would go up and study with them. It was really wonderful. And I was off and running in my homeopathic career, precepting and studying. And then you and I went to school together. It's 30 years ago now. We
Yeah.
went to the Hahnemann
But I'll
College.
tell you what, that was a great time. I mean, you know, I traveled all the way from Pennsylvania every month for a long weekend. And that was
Yeah,
probably
so
the
did
most
I. I
exciting,
came from Richmond.
yeah, that was probably the most exciting time in my life, learning homeopathy. I says, oh my God, I'm finally learning how to truly heal disease with homeopathy.
That was wonderful. And what I did was I would come the day before the Hahnemann College class and spend a whole day with Bill Gray, seeing patients with them. And then the day after, I would spend with Roger Morrison and Nancy Herrick at John Huntington Shore, and I would see patients with them. So I figured if I'm going to fly that far every month, I might as well get the best of it. It was a very, very good experience. And it's been,
Mm.
you know, I love homeopathy as you do. Constitutional homeopathic medicine is the most powerful bioenergetic medicine in the world, as far as I'm concerned. And I've studied acupuncture and Ayurveda and a lot of their systems. But I found that, you know, it works extremely well when combined with other therapies. You have to detoxify the body because we live in a more and more toxic environment. Nutraceuticals are extremely important to nourish the body because the quality of our food is not as good. And then adding in things like medicinal peptides that support the system's communication with cell to cell, and exosomes, which are like very powerful peptides, and then adding a microcurrent therapy like you do, which is amazing. And my experience of microcurrent therapy is like homeopathic application of electricity. It's really amazing.
Yeah.
And
Uh-huh.
all those modalities together stimulate the body's ability to heal itself, which God gave us the ability to do if we treat it right.
Mhm. Yeah, you're right. I mean, it's nice. There are some cases where the homeopathic remedy will work alone without any other modality. But because
True.
our society is so toxic, you know, heavy metal poisoning, poor diet and nutrition, a lot of suppression from years of using petropharmaceutical drugs. You know, I think people were a lot more healthy back in the early 1900s and late 1800s. I
Absolutely.
mean,
Oh, totally. You know, they weren't exposed to all the Wi-Fi, all the cell phones, all that energy, which disrupts the
mm,
bioelectric field of the body. We're
mm,
exposed to so much more toxicity just in the last few decades than our forebears were, for
mm.
sure.
You know, I found something interesting that in 1850 to 1920, macular degeneration did not exist. Can you believe that?
I can believe it.
Helmholtz discovered the ophthalmoscope in 1850, and doctors were recording all sorts of retinal pathology, but there was one case of macular degeneration. So macular degeneration is a disease of modern society
Civilization.
due to heavy
Yeah.
metals, our diet, pollution, and things like that. I find that so fascinating.
Mycotoxicity, bad
Mhm.
attitudes. Yeah. You
So,
know, people are not nourishing themselves in body, mind, and spirit like they need to.
mhm. so I think most of the listeners are curious about the peptides and exosomes, and that's a topic that I'm really not that familiar with either. So maybe you could talk a little bit about how you approach a patient with a chronic disease, how you incorporate homeopathy, what are exosomes, what are peptides, and how you utilize them.
Sure. Well, first of all, then my predominant modality is constitutional classical homeopathy. So I like to understand my
All
patients
right, two
physically,
thumbs up.
yeah, yeah, physically, emotionally, mentally, and spiritually. In fact, in order to truly heal anybody, you really have to understand them deeply to understand what are the issues that are going on with them. And oftentimes, people just come in with the symptoms and it's on the surface. But in order to truly heal anybody, you have to stimulate them from the center of their being, from the core of their being. And homeopathy is the main way in which you do that. And homeopathy helps you understand your patients more profoundly than any other system of healing, as far as I'm concerned, having studied a lot of the different kinds. Then I find that so many of my patients have illnesses due to toxicity. Like so many of the patients we're seeing these days with long COVID, chronic COVID syndrome, who have been poisoned by the bioweapon. I mean, their immune system have crashed. And in those cases, homeopathy is essential. Now, I found that homeopathy is fantastic for treating COVID acutely and getting over it. I have a slew of patients that got over it very quickly with phosphorus and gelsemium and other homeopathic remedies. But then when they've had the combination of having the illness themselves, getting over it, and then being forced by their employers or the government to take the vaccine, then their immune system crashes within hours, days, or weeks. And then they need more to support their system. And in those situations, I found that medicinal peptides, nutraceuticals, and the detoxification methodologies are extremely important. Now, peptides, to give people a baseline, a peptide is a segment of protein, essentially. It's a string of amino acids. And the human body actually, we now know there's over 7,000 naturally occurring peptides in the human body. And they are essentially human communication messenger molecules. That is, the different organs and systems of the body secrete peptides to stimulate other cells to do what they're supposed to do. Yeah, and it's very, very different than allopathic orthodox medications that force the body to do what it wouldn't ordinarily do and replace some symptoms with other symptoms. That's not the case with peptides. Because they're human communication molecules, the body already recognizes them and knows what to do with them. And they say, oh, thank you, I needed that. Now I can go to bed and do the appropriate metabolic balancing. For example, there's a peptide called BPC-157, which stands for body protection compound. It's a 15 amino acid, a peptidectic peptide that is produced in the lining of our stomach. Everyone produces it. And it is extremely important, one, for stimulating stem cell production in the body, helps musculoskeletal problems, but its main job is to heal the whole lining of the GI tract and to decrease inflammation, to heal ulcerations, any damage from what we do to ourselves from eating things. And it's normally produced in pulses. And I've used it for treating gastritis, Helicobacter pylori, ulcerative colitis, Crohn's disease, and it's absolutely fantastic for celiac disease. Celiac disease is a gluten allergy that's actually an autoimmune illness that severely injures the lining of the GI tract and also can injure the other parts of the body by stimulating other autoimmune diseases like autoimmune thyroiditis, cerebritis, hepatitis, you name it. And I found
So
that
these peptides are naturally occurring in the human body.
They're naturally occurring.
So
and the beauty of it is
what causes them to be decreased in the body, or what causes an absence? Because I'm assuming that when there's a change in these peptides, you have a physical problem.
Exactly. Like a lot of people who have chronic gastrointestinal problems have a deficiency in the production of BPC-157 in their gut. Other people who have immunological problems may have deficiencies in some of the thymic peptides. When we were little kids, we had this big gland in our chest called the thymus gland, and its job is to produce a whole range of immunopeptides, immunologically active peptides. And these thymic peptides are critically important for helping us fight off infections, cancers, and other things. And there's about 200 of them. The three most important are thymulin, thymosin alpha-1, and thymosin beta-4. And thymulin and thymosin alpha-1 stimulate the ability of the immune system to put out an appropriate amount of effective white blood cells to fight infections, whether it's bacteria, viruses, or fungi, and our cancer cells. And thymosin beta-4 is important for controlling inflammation and preventing scarring or sclerosis. So they all work together synergistically. And when we have chronic infectious or inflammatory or malignant diseases, we have deficiencies in these. But also, as we get older, the thymus gland involutes. It gets smaller and smaller and smaller. So by the time we're about 45, 50 years old, it's hardly producing any of those things at all. And we found that by giving these peptides back, we can then re-stimulate the immune system and help it function better. Fortunately, over the last 2 decades, the technology has developed to be able to produce bioidentical human peptides. So we can make exactly the same molecule as BPC, as thymulin, as TB4, all of these different peptides. And the pharmaceutical, the compounding pharmaceutical industry, which is separate from big pharma, they produce really fine, high quality products that I've used for the last several years with remarkable results. And
Now,
some of them are orals.
can you measure peptide deficiencies in the body? Is there a test?
They're not specific tests for the peptides yet because they exist in such incredibly small amounts. That technology hasn't quite been developed yet, but we treat according to symptom patterns. Like when you have someone come in and you see by their history and physical and their laboratory that they're definitely immunodeficient, you can do CD4 and all the rest of those studies. Then you know by giving them the peptides, the special thymic peptides, immunopeptides are going to help. Also in patients that come to me for memory deficits, for early onset or later dementia, or peripheral neuropathies like nerve problems, we know that there are certain peptides that help to heal the nerves in the body, in the brain and the peripheral nerves that are very effective. ARA 290, dihexa, superribulin. So there's a whole range of them that have been studied all around the world.
No, so
so we
let's
have a
take
set.
patients with eye problems, because most of the people on this webinar have eye problems. So if you look at
Mhm.
macular degeneration, glaucoma, or some other eye problem, are there specific peptides that can help?
Yeah. Well, in addition to, when I have a patient present to me with an ophthalmological problem, usually they've been to their eye doctor already and they don't like what they're being treated with, or it's not helping. And I actually have treated a lot of macular degeneration. I use a combination of constitutional homeopathy because you need that as a base to stimulate your body's ability to heal itself. And then I use specific nutraceuticals that I found to be extremely effective. One is called ASTAXANTHOL, which is a combination of very potent lipophilic, that is fat-loving bioflavonoids that are able to penetrate the blood-eye barrier. That's extremely important. You just can't take any regular antioxidants or grapeseed extract or ginkgo or things like that, because those are hydrophilic. They're water soluble and they don't penetrate the eye. You need one that's very highly bioavailable, and this one is made of 3 different highly bioavailable, long-acting, potent, fat-soluble antioxidants. So it gets into the eye and helps to protect the retina and repair the retina from oxidative stress. I also use a supplement called Brilliant Vision, which is a broad spectrum eye supplement that's meant to help the whole eye. We know, a lot of people don't know that the eye, you and I know this, is a very interesting embryological organ in that it's a combination of both the mesenchymal composed tissues, the front of the eye, and the back of the eye is an extension of the developing brain, the diencephalon. So the retina is actually like an extension of the brain. So you need components that help the nerve tissue, and things that help the retina also help the brain, interestingly. So this is a supplement that helps the whole eye. So I use those together, and I'll use them in combination with, depending on what caused the macular degeneration. If it's someone who has had a terrible diet and a lot of toxicity, I'll give them detoxification programs. Now I'm recommending that they get the microcurrent therapy after studying the information that you sent me. That's fascinating. And the kind of peptides that work best for the eye are the BPC-127, also thymosin beta-4. We can have them made up as eye drops that could be very effective. In addition, when you have macular degeneration, this is affecting the neurons of the eye. And there are specific supplements that have been found to be extremely important to nourish both the gray matter in the retina and the brain, and also the optic nerve, which is a myelin sheath, it's white matter. There was this brilliant scientist, Dr. Diane Goodenow, discovered over the last 20 years that the main component of neural tissue that hadn't been known before is a special kind of a fatty acid called plasmalogens. most people don't know what those are. They're essentially a special kind of phospholipid of which most of the neural membranes are made, and actually the lungs and the heart and the liver are too. And the body normally produces these plasmalogens inside these little organelles in our cells called um, peroxisomes. But as we age, these peroxisomes don't function as well, don't produce as much, and also due to chronic toxicity, due to EMF, due to oxidative stress, a number of things will help injure those very important organelles. And Dr. Goodenow and his associates throughout the world, first they discovered that you need these plasmalogens in order for the nerves to be able to fire correctly, to have good impulses. And then they created a special supplement that would stimulate the brain and the other parts of the body to produce it. So I give these two products. There's one product, it's an omega-3 phospholipid plasmalogen called PRODROME-NEURO, and that nurtures the gray matter of the retina and the eye, helps repair them and rebuild the membranes so they function better. And then there's one called PRODROME-GLIA, which is an omega-9 phospholipid plasmalogen that helps repair the myelin sheath and the white tracks. So the optic nerve gets repaired, the conduction pathways in the brain get repaired, the peripheral nerves in the body get repaired. And I've seen amazing results combining these two supplements, PRODROME-GLIA, PRODROME-NEURO, with other nutraceuticals like ASTAXANTHOL and Brilliant Vision, and then constitutional homeopathy and the peptides for repairing macular degeneration, uveitis, retinitis, other conditions, with very gratifying results.
Yeah, so it sounds like this would be a good combination, like you said, with using it with homeopathy and also with microcurrent, adding
Absolutely.
the low-level electrical stimulation to kind of support tissues and to, stimulate the healing process.
As I mentioned before, I really believe that microcurrent therapy is like a form of homeopathic electrical healing, because you're giving such tiny doses to stimulate the body to heal itself, just like we're giving remedies, infinitesimal doses to stimulate the body to heal itself. It makes a lot of sense.
Now, you talked about the peptides. What about the exosomes?
Exosomes, well, exosomes are really the primary product of mesenchymal stem cells. The highest quality stem cells are produced from umbilical cord, newborn umbilical cord. It's not from abortions and things like that. They actually take it from women, healthy women. They have to be screened to make sure they're really good tissue. And the best is from American hospitals, so you know what you're getting. And the laboratories then extract the stem cells from the umbilical cords. And I used to use mesenchymal stem cells quite often, but the issue is that they're very large cells. And actually, we're born with millions of them throughout the body. Like whenever you injure yourself, you cut yourself really badly, what causes the healing of that injury is the regional stem cells. They migrate to the area because they're attracted by chemotactic, by chemical influences, and that stimulates the healing. And the way they do that is the stem cells travels to the injured tissue, regardless where it is in the body. They then adhere to the blood vessels lining those tissues, and as soon as they adhere, they go into what's called a paracrine process, where they begin manufacturing large amounts of broad spectrum anti-inflammatory regenerative peptides. And then they invaginate, they take a piece of the plasma membrane, the cell membrane, and they make a little bubble out of it, which is an exosome, outside body. And they exude that, they propel it out, and it has little markers on it that attracted to the injured cells, which it adheres to the cells and then dumps the peptides into it. So an exosome is really a concentrated packet of broad spectrum anti-inflammatory regenerative peptides. So like a super peptide, but
So it's kind of like
it's
kind of like a healing Band-Aid, like a
it's
Band-Aid.
more than that. It's what our body actually uses to heal any acute or chronic trauma or inflammatory process. It's the exosomes. But so the main difference, a stem cell is the large cell that produces the exosomes, but the ultimate product of the stem cell are the exosomes. So in what happens is that when you use stem cells, you have to get them frozen, and you have to defrost them. They come at -80 degrees. And in the process of defrosting, you may probably lose 10 to 20%. You can't help it. And then when you inject them intravenously, quite a few of them will get sequestered or trapped in the lungs. So you don't get all of it in there. So after a number of years, I found an excellent source of exosomes. There's a laboratory in the United States. They take the exosomes and they culture them and they nourish them, and then they tease them to exude the exosomes, and they collect them, purify them, concentrate them. So you're getting these vials of pure exosomes that when you defrost them, none of them die, because they're not like a living cell. They're actually a packet of peptides. So they're much more stable. You can get a larger amount of them, whereas a 2 ml vial, a 2 cc vial of stem cells, you're usually getting about 10 million cells. Whereas in a 1 ml vial, 1 cc vial of exosomes, you're getting about 3 billion. So 1 vial of exosomes is equivalent clinically in their effect to like 5 or 6 vials of stem cells. So it's a bigger bang for your buck. And I find them to be far better tolerated and more cost effective than just regular stem cells. So I've used them. I've injected them into joints for healing. I've injected them intravenously for treating neurodegenerative diseases like Parkinsonism and multiple sclerosis, for which they work really well, and ALS, other conditions. I put drops in the eyes for treating chronic inflammatory processes. They're really quite remarkable.
So they can be administered either locally or intravenously.
Yes, absolutely.
Now, if you're using them as eye drops, that's mainly for just like a superficial problem. They don't penetrate the eye and go into the macula or the optic nerve.
Well, the exosomes, are very, very, very tiny, and they're subcellular, so they are able to be absorbed through the cornea into the deeper eye. And I've seen effects with macular degeneration using them. So maybe it's a combination of all of those things. But the peptides are also very small. Most of them are small, so they're able to penetrate tissues as well.
So let's talk about your general approach. Let's say you see somebody with an eye problem. What is your general approach to evaluating them and beginning treatment?
Well, usually I want to have the records from the ophthalmologist to see exactly what the diagnosis and treatment has been so far and how they're responding to it. And then I take their overall case. I see what else is going on in them that could be contributing to the ophthalmological problems. You need to find out, are they under a lot of emotional stress? What's their diet like? Are they exposed to toxins? Are they living next to Wi-Fi tower? What's contributing to their overall diminution in health, and correct a lot of those problems. Like Hahnemann talked about in the organ on medicine, you have to eliminate those causes contributing to ill health, and then by stimulating with homeopathy, you'll get much better result. And so I seek to do that, to nourish them in mind, body, and spirit. And then when I find a specific problem, if they're, for example, having macular degeneration, I will give them the supplements that I think will be supportive to them. I will watch the result of the homeopathic treatment and nutraceutical therapy for a number of weeks and months. If they respond, great. If they need an extra push, then I might add the microcurrent therapy and or a peptide or exosome therapy. So I treat each person completely individually, and only give them what they absolutely need and see what their body does with it. If they respond, if they're young enough and healthy enough, even if you're older and healthy enough, if you respond appropriately to the simplest measures, homeopathy and nutritional therapy, that's great. If you need more, then I add it according to what the individual needs.
So we have a lot of questions here that are coming in, and I don't know if you wanted
let's
to
go for them.
begin the
Yeah, let's
questions.
go ahead.
Can you open up the Q&A and
Let's see. It's Q&A.
I find it the best way
this.
is if people just join in the conversation. So those of you out there, if you want to raise your hand and you want to ask Dr. Fleisher a question, raise your hand, and then we can allow you to talk.
Now let's see here. The
So
first
all you got to
question
do
was,
is click the raise hand button.
all right.
Okay, I think
And
no, we don't have anybody here.
well, the first question, Ed, was I want to know how to get rid of floaters. Well, floaters, you know, they're like little pieces of dead retina floating around in the vitreous humor. I've got them too. I got hit in the head with a surfboard and I got plenty of floaters. And basically detoxification helps. Homeopathy and peptide can help over time. And you know, what's interesting is that after a while of having them, you tend to lose perception of them. But those are some things. I think detoxification is one of the best things. And another question
Sometimes
is what?
floaters can really be nasty, but I
Yeah, do you
agree.
have
You
bad
have to
ones
look
that
at.
need help?
Yeah, I agree that you need to look at detoxification, the
Microcurrent.
right nutrition. Microcurrent can be helpful, and also light therapy. Certain wavelengths and certain colored light can help reduce the inflammation.
What's the best colors for light therapy that you use? That blue and green or something?
Well, the light therapy depends on the autonomic nervous system. There's a
Cool.
system of therapy called syntonic light, and the goal is to balance the autonomic nervous system. So if there's a lot of inflammation, you want to use more of the blue spectrum to push you more towards the parasympathetic. If there's a lot of anxiety, the blue spectrum. But most people that I see are elderly and they have adrenal fatigue. They actually need to put more energy into their body, so you lose more of the red spectrum. Yeah, so there's a whole spectrum that we use, but the goal is, I mean, I'm sure you agree with me that the body cannot heal if the autonomic nervous system is imbalanced. You know, if you're under stress, the body will not heal. So light therapy helps balance the autonomic nervous system for healing.
And homeopathy is fantastic for that too. There's a question here. I have retinal degeneration from extreme myopia. What can help? Well, you can answer that, Bart. I mean, the retinal degeneration, of course, could be helped by homeopathy and nutraceutical support and microcurrent. As far as the myopia, Ed, what would you do for the myopia?
Well, myopia is kind of a genetic problem, but there's been a lot of studies to show that sugar causes a progressive myopia, which is kind of interesting. You know, I think sugar is a big poison.
Oh, totally.
So studies have shown that if you reduce the sugar early on in life, you can reduce the progression of myopia. And of course, there's a lot of eye exercises you can do. There was a turn of the century ophthalmologist, William Bates, who talked about palming, sunning. So there's a lot of modalities. And of course, good nutrition and, you know, constitutional homeopathy, microcurrent, all these things. We have somebody.
I prescribed a lot
Ananda,
of Bates eye exercises. Very helpful.
Yeah, Ananda. Hello. You're live if you want to ask Dr.
Can you hear
Fleisher.
me?
Yep.
Can you hear me? Okay, fantastic. Okay, I have macular degeneration caused by a procedure done when there was a tear in the retina. Like I had nothing else before the small tear in the retina, and then afterwards my eye has just been a mess. It has epiretinal membrane with lines all over it and dots all over it, macular degeneration. All these things have happened after this procedure. I'm very healthy. I've been vegetarian since I've been a child. I'm a yoga instructor. I'm detoxing and things like that all the time. And I do work with homeopathy and all sorts of natural medicines. I couldn't catch like some of the supplements that you were naming that might be good for my situation. I couldn't catch the names because you were saying them quickly. I don't know whether it's something that I should look into myself or whether I would need to have a consultation to know dosages and things like that. So could you guide me a little bit in that way?
Sure. I'd want to know your whole state and to find out what, the other contributing factors are to be able to prescribe appropriately, because each individual might need a different amount of supplements, a different combination of supplements and peptides. So you're welcome to contact my office for a consultation. Like the number is 434-361
361
1896.
1896. And where are
Maybe
you
you could,
located?
maybe you could
I'm
put
in
that in the
Virginia.
chat.
Okay.
In the chat.
Yeah, to put your number in the chat. And also maybe you could
see.
put the nutraceuticals, Mitch, that you recommend, put that in the chat too.
Oh, that would be great. Yeah,
Okay.
thank you.
Yeah.
Let's see. So, okay.
But I find it interesting that all of this began with your ophthalmic procedure. So there should be
Yes.
specific homeopathic remedies to deal with that, the trauma of the surgery.
It's the trauma of the surgery, because really, like, even I've had like like it's mild, but I've had numbness on my face on that side since the procedure as well. So
have you been treated by a competent homeopathic doctor? Because a lot of doctors say they're homeopathic, but they may have taken a weekend course.
No, I've been
Right,
treated
exactly.
with people. Yeah, no, exactly. No, I've been treated with people that are like, forerunners in the homeopathic world. Although I do have to say that very few of them have any eye knowledge. Like they all kind of like, we don't really have this in, like, it's not something that they seem to like, it's just they're guessing a little bit. And we're working with different constitutionals and things like that. So I've had a hard time finding anybody who has any real experience, like they're guessing, like they've never really, okay, maybe this will work. We don't really know. It's more like that.
Yeah, well, that's where my expertise. I'm probably the only homeopathic ophthalmologist out there.
Probably.
So that's the advantage I have. I can really look at your pathology, what's going on with your eye, and try to, select a homeopathic remedy.
Okay.
What's interesting is that the materia medica and the repertories are the eye is really and vision is really well represented. It's just very few homeopaths may use those sections.
Interesting.
Yeah, because of the language, there's a lot of terminology that the average medical practitioner doesn't understand. So maybe you and I could talk about that.
Okay, thank you.
Okay, we have,
you're quite welcome.
Thanks for your question. We have Susan. Let me put you on here. Susan, how are you?
You. Hello.
Yeah,
can you hear
we can hear you. Uh-huh.
I'm the one who wrote in the question about the retina. But he said stuff so fast I couldn't catch it. My other condition is
I think he's going to, Susan, he's going to type
right. Well, the problem
he's going to type his favorite nutraceuticals in the chat.
Okay.
And also his favorite peptides in the chat. And what I'm going to do is, this is being recorded, and all of you that have signed up, you will get a list of the nutraceuticals and peptides and exosomes that he recommends. Okay.
Okay. I also have what they call a staphyloma. Can that be, and that has affected my central vision. I have lost my independence through it. I can't read right now. I can't even write. All I see is like blurred out white stuff. I can't drive right now because I can't see down the road. I've lost the detail. When I saw my retinal specialist, which I saw on Monday, you know how they go, like, well, live with it or whatever. And I'm like, no, I will not live with this. There has to be something I can take to kind of repair it.
Well, staphyloma is a thinning of the retina, and I think you have high myopia, correct?
Yes, extremely high. I was born that way, yeah.
And it's caused by a thinning of the retina. So the thinning of the retina has caused a blind spot, an area that is not functioning.
Correct.
So my interest is that there's probably retinal cells and material surrounding that staphyloma that that can be regenerated. You have the scar tissue, which has no function, and then you have areas that maybe we can stimulate them to improve your vision. So that's where the nutraceuticals that Dr. Fleisher talked about, and also doing things like a microcurrent, trying to stimulate those surrounding cells to begin to function. Now, I do believe that the body has the ability to regenerate. And I think that, miracles happen.
Right.
If you cut your finger, it'll heal. So why not a staphyloma heal? Modern medicine doesn't believe in those things, but I do believe
right.
that proper, well, here's an example. When I was in my training, we were taught that the corneal endothelium cannot regenerate. If you got that wrong on a test, your back of your head was slapped. But now doctors have found that the corneal endothelium can regenerate. So, it's a lot of times our thinking is limited. I believe miracles can happen. The body has an amazing regenerative property. But as Dr. Fleisher said, you got to treat the person.
Right.
So we're not treating Susan with a staphyloma. We're treating you as an individual, how this is affecting you. How is your life limited?
Right.
All this. And that's the miracle of homeopathy. We see.
We also taught that that people who have had strokes can't repair the brain. That part's completely lost. And yet I've had over the years, people come to me with cerebral vascular accidents, and I treat them homeopathically over a series of remedies. I give them specific nutraceuticals, some of the things I've mentioned here for the eyes, because a lot of the things that help the retina will also help the brain, and they've recovered function. I've had someone with partial hemiparesis, that is paralysis of one side of the body, and over a course of a year or two, it completely healed, to the amazement of the neurologists and neurosurgeons and physical therapists. But it is possible. The body has an amazing regenerative capacity if we just give it a chance by detoxifying, giving it the right nutrients. Now, in your situation with the thinning of the retina, you're going to want to give supplements that nourish the neurons. And you see, the neurons, the membrane of the neurons are made of these special plasmalogens. And just as people with stroke or dementia we have an atrophy of the brain, shrinking of the brain, you may be able to use the special plasmalogens to gradually over time regenerate the neurons so they function better, and you get a thicker layer. And we just have to see. Plus, you might benefit from peptides as well.
Because I also had, from a car accident 9 years ago, severe concussion, and that's really then when my started deteriorating even more. I was functional up until then, and I mean,
makes
I got back
perfect
with 4
sense.
airbags.
Yeah, in
That makes perfect sense, because
in homeopathy, we love it when
works fantastic.
somebody tells us, I've never been well since.
Right.
I've never been well since the car accident.
Right.
Then that kind of, we focus on specific homeopathic remedies that address that
then
problem.
We go to the head suction injuries after. And a lot of the remedies in that rubric, homeopathic rubric, it's usually one of those remedies that can help. And combining that symptom with all your other symptoms can specifically direct your healing energies towards that problem. But yes, absolutely, as Ed is absolutely correct. We love to hear symptoms like that, never well since, because that's a clue to what your body needs to recover.
What can you do next to get help?
Yeah, so sometimes the most complex problem has a very simple solution.
Sometimes. For example, I had a patient who had chronic low back pain and leg pain, bilateral, both sides, sciatic of years and years and years, went through multiple surgeries, nothing helped. And then when he saw me, this is was 25 years after the original injury. He had fallen while skiing on his butt, and he slid right into a rock and crushed his coccyx, his tailbone, and it created lightning-like pains up his back to the back of his neck. And from that point on, he had all these symptoms, and all the surgeries, all the drugs he took, nothing helped. And I took those symptoms, injury to the coccyx, trauma to the coccyx, shooting pains up the spine, and along with his other symptoms, gave him a remedy called Hypericum perforatum, which is St. John's wort, and high potency, a few doses. And within 3 months, he was completely pain-free. And it was a trauma remedy based on the initial trauma, never well since. So that's just one example.
You're in Pennsylvania. How can
I'm in Pennsylvania. How can I get help?
Virginia.
Or are you?
I'm in Virginia.
Oh, you're close by. He's close by. I can drive to Virginia. Where in
I put
Virginia?
I'm in the Blue Ridge Mountains, between Charlottesville and Lynchburg. It's very pretty here. It looks like Tuscany.
How do we
How
get
do-
the address?
How do we get the address? We might be visiting you. You're
Yeah,
close.
if you just
No
my
offense to the other
website.
doctor.
No. Well, Ed is fantastic too. I do a lot of online stuff too for people who can't travel. But my website it's simple. It's www.CIRM1.org. It stands for Center for Integrative and Regenerative Medicine. CIRM1.org. I'll put
And
it
I'll
in
be
the
putting
chat.
his address. I'll be mailing it to all of you if you want to contact Dr. Fleisher, his address. Okay.
Definitely.
If we want to contact him.
And if I want to contact you, how do I do that?
Contact
Me
me.
or Ed?
Yeah.
Okay.
Him.
You want to talk to
Oh, it's
My information, I'll put it in the chat, is healingtheye.com, all one word, healingtheye.com.
okay.
all right.
And Ed and I work together, so.
Oh,
we
good. Okay,
can
then you could tell them if you see me, what a mess I am.
No, if
Yeah, we
I
can-
if I have
I'll
an
be a
issue that,
challenge.
yeah, we homeopaths consult each other because there's not a lot of us in the world,
I know. So I know I was guided by spirit because I've been doing energy work, spiritual work, even for my eyes. They actually have improved somewhat, but I know I
Mhm.
still need the physical part to be done yet.
Yeah, sometimes
Sure.
homeopathy can act as a catalyst just to stimulate the
Right.
body in the right direction.
Yes.
So
And I'm
wonderful.
grateful.
that's basically the underlying idea of homeopathy. Is that
Oh,
we're looking at all your physical, mental, and emotional symptoms with what's unique about them. Not just that you
Mhm.
have pain in the eye or inflammation, but
Mhm.
how you experience it, what makes it better, what makes it worse. So how you uniquely experience your physical symptoms, but you also look at your emotional nature, your worries, anxieties, fears, grief, shames, whatever has molded you that, and then is your mental state, your beliefs,
Mhm.
disbeliefs, dreams, opinions, daydreams, delusions, and then we take all the physical and emotional, we look at the nexus, the crossroads, and then that constellation of physical and mental, emotional, spiritual symptoms that describes you as a whole person. That's
Mhm.
what we analyze to find what we call the true constitutional simillimum. That is the most similar remedy. That remedy acts as a bioenergetic catalyst or stimulus to give your God-given innate defense mechanism the energy information to do what it would have done to begin with. It kickstarts your own healing engine, and then it makes anything else you use, whether it's nutraceuticals, peptides, microcurrent, whatnot, work better. So that's a base phenomenal therapy.
Oh, thank you for all of that. This has been really a blessing for me because I'm
Okay,
just
well,
at a loss.
okay, we have another
Well, hopefully you will know.
Thank you.
hand up.
Go ahead.
Santi,
Okay.
if you could unmute yourself, you have a question for Dr. Fleisher?
Yes, I do. Can you hear me?
Yep,
I
you're
can
coming
hear you.
through.
Oh, perfect. I have geographic atrophy in both eyes. I've got about 25% left of my vision. I was an alcoholic for 10 years when I was very young, started drinking at 8. And I've been sober 44 years. And I, like this other woman that was sharing, very healthy lifestyle. But nothing has worked. I had dry macular that went into geographic atrophy about 3 years ago. I have a couple, and I've had 3 pretty violent head injuries. I was beaten as a kid. So I'm kind of it's my Hail Mary pass here, trying to find out what would help. And I also have a wonderful retinologist, and he was suggesting the shots in the eyes that have just come out through Apellis Pharmaceuticals for stimulating the complement immune system. But I'm really scared to do that. And if there's a way to stimulate the complement and how you feel about the complement immune system, and would these neuropeptides be another way to go? I'm really, really interested in the homeopathy, so I will definitely be giving you a call. So could you address that shot and how you feel about it, if you know anything about the shot for the dry AMD?
Well, that's just something new. It's experimental.
Yeah.
And
Yeah,
typically, I'm
experimental.
always suspicious when something comes out from Big Pharma. Big Pharma is lying to us. Big Pharma is really not interested in curing disease. And
I
that's
agree
why I
with that
love
100%.
homeopathy. For example, I had severe adult onset asthma, taking 3 medications. No one could really help me. And one homeopathic remedy cured me of my asthma. That began my quest to find out, can homeopathy help with eye diseases? And to my surprise, in the late 1800s, early 1900s, the majority of ophthalmologists were homeopathic doctors. They were using homeopathic remedies, doing remarkable things, but it's been suppressed by Big Pharma. So I would really caution you against using these injections. You have to
totally
look
agree
at
with
the
that.
underlying cause. Underlying
Yeah, I totally
cause,
agree with that.
strengthen the body, begin with nutraceuticals, maybe the peptides, the exosomes, microcurrent, light therapy, all these things to help the body regenerate itself.
You know, you have several causes, Santi, that could contribute to what's going on with you. Those years of alcoholism depleted your body of a lot of nutrients. And also alcohol is a lipid solvent. It dissolves fat, and it would damage the retina and the brain, and strip it a lot of its phospholipids, important membrane tissue components. So to replenish those is going to be critically important. In addition, if you have any underlying inflammation, that's going to be addressed by homeopathy, nutraceuticals, peptide therapy, exosome therapy, and especially microcurrent. So there's a lot can be done with you. Also, your history of multiple head traumas, that is something that's a signal to us too, that has to be addressed. How much does that contribute to your chronic eye problems and other issues in your health? So, but you have, with all of those things that are happening to you, it's a multifactorial approach that has to be taken in order to really restore you to health.
Yeah, those symptoms that you talked about, your life history is perfect for a homeopathic consult, because we want to find out
Totally.
more about you. You know, the trauma you had, your tendency towards alcoholism, all these things will lead us to the right homeopathic remedy that in many cases can work magic. I love it when patients tell me, I don't know what you gave me, Dr. Condra, but I feel so good about myself. It changes the whole dynamics of your body. Isn't that wonderful? If you feel good
Yes,
about
it is.
yourself instead of having anxieties and worries and physical problems. That's the miracle of homeopathy. Oh, some people are having trouble using the chat. I don't know what's going on, but if you do have a question, type it in the Q&A.
One of the things that's very important to understand about the homeopathic approach is that our goal is very different than allopathic orthodox medicine, is that we're not just about taking away a symptom. What we are about is freedom from limitation, true freedom from limitation, physically, emotionally, mentally, and spiritually, so that you can live the fullest life possible and be available to other people and serve the world in a Christ-like way. Freedom from limitation is the homeopathic goal.
Mhm. We have a question. Someone had cataract surgery, developed wet macular degeneration. I'm assuming that the wet macular degeneration developed after the cataract surgery, and they have some bleeding. So that's kind of interesting, because I really believe that cataract surgery can be suppressive. In other words, if you rush into cataract surgery, you're really not looking at the underlying cause, why you have gotten the cataracts. So in homeopathy, if disease is not treated properly, it's pushed deeper into your body. So it could be that the macular degeneration was related to the cataract surgery and the bleeding. So we would look at homeopathic remedies that have this tendency to bleed after trauma. We would look at what was going on in your life when you developed the cataracts, and then hopefully that would help us select a proper homeopathic remedy. But other things like Dr. Fleisher talked about, the nutraceuticals, the peptides, the exosomes, microcurrent, all these things can help. You want to comment,
But also,
Mitch?
one of the other things I find is that when I know that one of my patients is going for some sort of surgery, there are remedies in addition to their constitutional that they can use preoperatively and postoperatively that can help prevent a lot of the complications of surgery. Like, for example, one of the most common remedies is Arnica montana, leopard bane, which helps prevent capillary bleeding, and it helps deal with bleeding or hemorrhages after trauma. Some patients might eat phosphorus, they're easy bleeder. So there's different remedies that we can give to either help prevent and or treat any traumatic events or related to surgery.
Okay, let's see. Victoria. Let's see, Victoria, you're on. You have to unmute yourself if you have a question for Dr. Fleisher.
I was visiting Dr. Conrad until he moved away. And my question is, can I fly? Can I travel by airplane? I have had the glaucoma, and now I have cataracts. And the doctor here wants to operate my eyes, but I would love to go see if I have to travel by plane to see you. But can I travel? Will the pressure go up because of the glaucoma? I am not.
No, there's really, first of all, there's really no
No.
danger of pressure changes with glaucoma when you fly. There is a problem if you have like a sinus problem because you have changes in the air dynamics when you fly with the pressure change. But there's really no risk of air travel with glaucoma. But I am not seeing patients physically. All my evaluations are done on Zoom. I would be happy. In fact, I would be happy to take a look at your records, and I do this as a free evaluation. You send your records to me and I'll give you recommendations. So,
Thank you.
what is your question, or what you have glaucoma? And
I have
what is your goal?
glaucoma. I was examined by you, Dr. Conrad, and I used the red light and the green light and the microcurrent. And but I see that the glaucoma has improved, but the cataracts are overpowering my right eye.
So we may have to reevaluate you to find out why is the cataract, but it's wonderful that the microcurrent and light have helped the glaucoma.
Yes.
Now we may have to look at why.
Yeah. The drops that are for the pressure, I don't use them at all because they were destroying my salivary glands. And my face was swelling.
Oh, it's interesting. If you would ask your ophthalmologist, can light therapy help my glaucoma? He would probably laugh at you.
Yeah.
But believe it or not, in the American Journal of Ophthalmology, in 1948 and 1949, there were articles published on the benefit of light therapy lowering the intraocular pressure.
Yeah.
That's a peer-reviewed journal. That's our top journal. So light therapy can be beneficial in treating
And
glaucoma.
it probably needs a readjustment because I have been using it like for 4 years, the same thing. So you probably need to redirect me, right?
Yeah. The body, anytime you're using microcurrent or homeopathy for a long period of time, sometimes you need a change in your remedy, or you need a change in the microcurrent frequencies.
Our state changes.
Yeah.
Hello, this is Robert. I'm Victoria's husband. And something that has come up is that her doctor in Orlando, we're in Florida, he insists on her having cataract surgery, which of course we don't want to do. So what is your recommendation? I know that they say that there's no cure for cataracts, but would homeopathic medicine, drops, or what is it that she can do so that her cataracts will not get worse?
Well, out of all the conditions I treat, cataracts are probably the most difficult because you have to look at the underlying problem. The big underlying problem with cataracts is nutrition. I did mission surgery in Africa and Central America, and it's shocking. You see young people, 18 and 19-year-olds with advanced cataract. It has to do with nutrition, in particular vitamin C. And also heavy metals. Heavy metals are related to cataracts. So we have to look at the underlying cause, but there are ways of reducing the cataracts with homeopathic remedies, with microcurrent, but it all depends on how advanced the cataracts are.
Yeah.
Right.
If you have a cataract that's completely blocking your vision and you can barely see light, the chances of reversing it are very, very slim.
Yeah.
Do-
But
I
on
can
the other
see-
hand,
Yeah.
if you still see, you can make out numbers and read a little bit, then there's a good chance we can reverse it. But the most important thing I want to tell you is we have to find out the cause of the cataracts.
Yeah.
So if that underlying cause is still there and that's not treated, then after cataract surgery, it could lead to problems with macular degeneration and other issues.
Dr. Conrad,
One thing I find very common in my patients who develop cataracts is they often have pre-diabetes, that is insulin resistance, which is often nutritionally caused, and that absolutely has to be addressed if they're going to heal properly.
Okay.
yeah, she's
You
not.
know
I don't
what?
need
It's
sugar at
interesting.
all.
The old time eye doctors felt that there were two poisons that caused cataracts: sugar and salt. They were the poisons.
Uh-huh.
Dr. Conrad, because my wife has seen you, she saw you for years when you were down in Florida in Zephyr Hills, but now you're so far away, so there's no way that she can see you, obviously. But because Dr. Fleisher is so close to us, and I love Virginia, so I don't mind going up there. Is that something? So
Yeah,
You
in
will
fact,
kill two birds with one stone.
yeah, do you? should
Dr.
we?
Fleisher and I will work together.
They work together.
So if you want to
Oh.
see him physically, he can call me and we can consult. But the first thing to do is send me a copy of your records, and there's no
Okay, I
charge
think-
for this. Go to freeconsult.us.
Oh, okay,
I'll
yeah,
type that in the chat.
Okay.
Freeconsult.us. Send me the records
You have that all?
and I'll make some recommendations.
okay, so we will do that, yeah.
Good.
Okay, we sent you one not too long ago, but
Do you keep the records that we
Yeah.
send you?
so you probably have them, maybe like
Yeah, I would
6
talk to the
maybe.
office. I'm going to type that in the chat. Free www. freeconsult.us.
Free consult.
Great, okay,
Or you can call the office. We still have the same number.
yes, oh, yes, we talked to, what's her name, Chris?
Chris.
Chris,
Yeah,
yes,
Chris can check the records.
She can check
and
the
I
rec-
can make
yes.
some recommendations. But
Yeah.
sometimes you do have to physically see a doctor, like Dr. Fleisher may recommend some IVs or some type of therapy that I can't do over the phone.
Wonderful,
But I
okay,
do homeopathic consults, evaluations, and they can be very effective, making recommendations.
great, okay, thank you.
Thank
Dr.
you so
Sandra.
much.
Okay, thank you, Dr.
Okay,
Fleisher.
thank you.
Thank you.
De nada.
Let's
De nada, gracias.
see here if anybody else have a question, raise your hand. And let's see if there's anything in the chat. Oh, here's a good one. Dry eyes that develop after cataract surgery.
Oh, my goodness.
Yeah, and that's a very
That's
common
often-
problem.
Yeah, that's often nutritional deficiency. A lot of people are vitamin A deficient. That results. in
And
that.
also they're dehydrated. You got to drink more water.
Yes, that too.
And I love,
Not drinking enough water.
I love ozone eye drops. They're
Yes.
wonderful.
Ozone
to
I
help
make them in my
reduce-
office for my patients. They're great.
Yeah. I have a couple of YouTube videos. Go type my name, Condrot Ozone, and I show you as a YouTube video on how to make them. But they're wonderful for dry eye patients.
They're also
They're
good for eye
very-
infections.
Yeah, eye infections, because now a lot of swimming pools are using ozone instead of chlorine to fight
Exactly.
the bacteria. And ozone, highly reactive form of oxygen, which can help in regeneration. Chelation therapy for macular degeneration. Dr. Fleisher, you want to take that one? Chelation.
If they're talking about EDTA, chelation therapy, ethylene diamine tetracetic acid,
Chelation.
most cataracts are not necessarily due to calcium and the minerals like that, or heavy metals in the eye itself. It's what it's the heavy metals in the body, whether it's lead or mercury or cadmium. They tend to cause free radical oxidative stress, which is what's going to cause most of the problems in the eye and the retina and in the lens itself. A lot of the, if you can correct me if I'm wrong, a lot of the cataracts are due to xylitol and other materials that are depositing either in centrally in the lens or on the subcortically in the back of the lens, rather than calcium and things like that depositing in the eye. So EDTA is not necessarily going to help that problem, but it will certainly help decrease the burden of toxic heavy metals in the body, particularly lead and mercury and cadmium and aluminum and things of that nature, which are causing neurological damage long term. Because these heavy metals, they are not only directly neurotoxic, damaging to the nerves, but each molecule of these heavy metals is a very strong free radical generator. So you're having both problems. And so getting them out of the body down to a more normal level and taking proper nutraceuticals to repair the chronic oxidative stress is going to be critical to healing.
I think the question was related more to macular degeneration. And one thing is that the chelation will remove the heavy metals, which are neurotoxic to the retina and to the brain. And also chelation will improve the circulation to the body. And that's one of the culprits why you get macular degeneration, a decrease in circulation. So, chelation therapy can be very beneficial, especially if you have heavy metals. And if you have cardiovascular disease, if you have circulatory problems, definitely look at chelation.
I've been doing IVE chelation therapy for almost 30 years now for my patients with cardiovascular disease, just heavy metal toxicity generally, and also for neurodegenerative diseases, and it's very effective. I just recently had a police officer, he was actually a state trooper, and he came to me with memory problems because he had to shoot his gun on the range every week for weeks on end. And he was wondering, all this lead dust floating in the air, is that a problem for him? So we did a 24-hour urine and his lead was off the charts. So we chelated him for about 8 months and his memory came back. He's feeling tremendously better. So yes, you can chronic lead toxicity can definitely cause some significant problems. And I've seen it really benefit people who have high blood pressure, who have kidney problems, who have cardiovascular problems, neurodegenerative problems. So that in conjunction with certain nutraceuticals and homeopathy can be very, very effective. There are also certain supplements that help to dilate the blood vessels, niacin amongst others, that also improve circulation to the brain and to the eyes and other parts of the body that could be helpful.
Yeah, one of the first things I do anytime I evaluate a new patient is to get a urine challenge test for heavy metals.
Exactly.
And this is a test where you do take a chelating agent and then it'll kind of liberate the heavy metal so you can measure it in your urine. The mistake is a lot of doctors, traditional doctors, will just do a urine or blood test and it's not going to show any heavy metal toxicity because those heavy metals are locked into your bone, your brain, fat, different parts of your body. You have to take a chelation agent, then measure. It's called the urine challenge test.
It pulls it out. Right. There's a special protocol that you use an oral chelating agent, usually in conjunction, like DMSA, democaptocystic acid, along with R-lipoic acid, and it helps pull the heavy metals that are bound to the lipids of the proteins in the body and dump them into the blood, which can be delivered to the kidneys, and then you can urinate them out. And the R-lipoic acid helps to prevent them from recirculating into the brain. So those are critically important. Exactly, Ed is exactly correct. If you just do a random urine test, you will not get an accurate measure of heavy metals in the body. It absolutely has to be a chelation challenge test, and then you get a relative measure of what's going on. And also the blood test that they do for heavy metals is inaccurate because it's red blood cells. They measure the amount of arsenic, lead, and mercury in those cells, but they don't collect that much. So it's not an accurate measure and it's an expensive test. Also, the hair test is just a screen, but your hair can be easily contaminated. So the only true test for assessing the relative amount of heavy metals in your body is a 24-hour provocative elemental urine analysis.
Okay, it looks like we don't have any more questions here. So Dr. Fleisher, I want to thank you so much for being a guest on Healthy Vision
My
and for
pleasure, Ed.
sharing with us some new and exciting approaches to reversing eye problems. And folks, this is recorded, so I'll be sending you a recording along with Dr. Fleischer's contact information. So thanks everyone for joining. And next month, I hope to see you on Healthy Vision. You can get an update by going to healthyvision.us, healthyvision.us. Dr. Fleischer, thank you so
Bless
much.
everyone.
Thank
God
you
bless you, Ed.
so
God bless you
much.
all.
Thank
Blessings,
you. Thank
everyone.
you.
Bye-bye now.
Thank you. Yes.
Bye.
Many thanks.
Thank you.
Yes.
Many